Hey guys, it's Adri with Essentially Oregon and Stacked Posture. And today I'm going to be sharing with you my journey with baby number 3, all the way from labor and delivery through the baby blues, so the first 2 weeks postpartum. And I'm going to be sharing some massage tips, essential oils, my favorite products, all sorts of stuff, self-care, baby care. So if you're interested in all that, stay tuned, and I will be putting in the comments kind of when I start different topics so that you can jump around and come back to it later and be able to find it easily just for your benefit. So I hope this video helps you guys, and here we go. So I started laboring about 10 o'clock at night. It's always at night, right? So I was able to kind of just wiggle through most of it until about 3 a.m. and that's when it started to pick up and I needed to do more than just kind of move. So I got up and got my reduce bleeding blend that I'd already been using for the last 3 weeks because baby girl was 10 days late. We were actually going to the hospital to induce the next morning. So thankfully, labor started on its own, which is always nice. I feel like I was doing everything, and then she decided to come, so that was great. The Reduced Bleeding Blend is from Stephanie Fritz's book, Essential Oils for Pregnancy, Birth, and Babies. There's a newer version you can find on Amazon, and it's a must-have for all moms and moms-to-be. And that goes on the uterus and then also on the uterine points, reflex points on the foot. And I really feel like that helped because I've bled hardly at all with this one. This has definitely been my best recovery so far, and actually delivery. So that's kind of why I wanted to share all these things, because it's my third go around and things are getting better. So that's great. At home, Serenity was diffusing, and Serenity Wild Orange, because that's just what we diffuse at night. So I just left that going. And it was really great. And about 5 a.m. things really started to pick up, and then we got to the hospital about 7:30, and then I put Serenity Wild Orange, Peppermint, and Arbor Vitae in the hospital diffuser because peppermint is an uplifting and oil that's able to focus. Okay, so it provides some clarity of mind, and when you're laboring, you don't want to just like have thoughts running everywhere, so it helps you just bring stuff in and focus. Obviously, the Serenity is to calm, Arbor Vitae also to calm and to cleanse, and the Wild Orange is to help maintain an evenness and also is uplifting. And people are coming in, they're like, it smells amazing in here. I'm like, I know, it's nice. It's very comforting to me too. So that was a great blend. You should try it at home. And obviously when you go into labor, you might not like what you have tried and have been doing at home. So take a few options, all right? And I have a whole video on my hospital bag, so you can go back and look and watch that one for all my essential oil tips for that. So when things started to pick up, I had the yoga ball there, and I was on that because movement is just so healing. It's just really great and really important. If you can take the pain, and you're gonna definitely try to do it naturally, to be moving throughout. So if you're gonna be walking around or on a ball or towards the end, towards transition, I was leaning with my knees on the bed and leaning over, but still able to like move. So something like that. And my husband grabbed the Deep Blue plus Copaiba and was rubbing my lower back and definitely my sacrum. My SI joint on the one side was a little off. Thankfully, I went to the chiropractor the day before. Chiropractic is really important for when you're pregnant, definitely as you're getting towards the end. Want everything to be in line for our bodies to be able to work optimally to push the baby out. Okay. And then on the sacrum are several bearing down points in the second fossa, which is if you go from SI joint in towards the midline, and then you kind of feel for those like holes, and it's the second fossa, so it's the second hole of the sacrum. And he was just pushing that. But obviously, if you're using your thumb too much, okay, so ladies, inform your husband sweetly, as he's going to be supporting you, or your doula. They should know better, but to use a knuckle, okay, so you can do that a lot longer, and definitely you can do this like all day long. Okay, not this, but line it up, and you can use a lot of pressure, but not a lot of energy is spent for a guy that's just going to be like leaning into you, okay? Because we don't want them wearing themselves out, okay? Because we need them to support us, okay? We need their verbal support and their physical support. So anything to make it easier on your man, you want them doing, okay? Because you need them. Definitely if it's not your first child, like they need to go home and be able to support you in helping with the other kids, okay? So anywhere that feels good, obviously just tell them what feels good. And then I was using the Aroma Touch blend, having him put it on my shoulders and kind of upper back, because we don't want to labor through contractions like this, okay? Really slack the jaw, okay? Really relax through here, so you're breathing. Your cervix will mimic what your mouth's doing. So if you're like this, your cervix is not going to dilate. And we really want it to dilate. So just relax. And then don't have your shoulders up by your ears. We need them down and back. Elongate the spine. And then relax the shoulders, okay? Breathing through the contractions, okay? Breathing. That was good for me. There's lots of different techniques, though. I'm not going to go through all of those today, okay? I was doing the pain blend, which is awesome. It has copaiba and black pepper, and what else did I put in there? Like cypress and a lot of things. I can put that in the comments too. All over my lower back, and then a little bit in the front, just as the contractions were getting really intense and I was getting a lot of pain really low. Definitely as we were heading towards transition, okay? Because yeah, that becomes really intense, okay? Now, having a baby, girls, it hurts, okay? I think you know that. I'm not trying to scare you, but you do need to prepare yourself for a pain, especially if you haven't had a baby, right? Or you had a, epidural and you want to try natural or whatever. Prepare yourself for intense pain. What's great about it, though, is it ends, okay? It's not just a chronic thing that you're going to have the rest of your life. And then you get to hold your sweet baby when it's all done, okay? And it's just wonderful. So thinking about that, getting verses, I really loved having Shane and Shane's song that is from 2 Corinthians 12:9, is my grace is sufficient for you, for my power is made perfect in weakness. And that's just beautiful, right? Because it's not like I was like, okay, yeah, I'm just gonna go push out this baby. But no, like I was able to have enough. Okay, I had enough and I was able to do it, and yay. And you just got to stay positive, right? So speaking of positivity, so here are my notes. In transition, okay, you're probably going to want something else in the diffuser, like Motivate or another citrus, something cheer, something that's going to really help you in kind of your subconscious, because you're not super conscious right now. I was just like, put in Motivate. That helps uplift the mood and is helpful to focus and just be more present, like in that way that's beneficial and not calming, but more inspiring. Okay, so definitely try something like that. Okay, if you're in transition, have somebody else, hopefully you have a doula and your husband or someone there who you can just instruct to do the essential oils. And then we got the pain blend back out, and I was like, just rub it on my sacrum. And then the nurse came over and was like gently rubbing on my sacrum, which was really nice. Like I was like, no, just, like push more. But the gentleness when you're in transition and it's already so much more pain was a great way for me and for my body to realize, oh my gosh, I am clenching. Like I'm trying to just get through this contraction. So I was able to release that pelvic tuck that I was in and tilt, because we want the baby to come down through that hole. And if you're tucked, it's this kind of a movement they'd have to go through, versus if you're tilted, that hole is going to be more vertical a little bit, and then everything's more in line, and baby's going to have more room, to come down. Definitely, earlier I was doing the sit bone pull, butt pulls, trying to just widen everything. It really felt like that helped, because my other two, I had to push them down from like way up high. So she was engaging. I actually felt the ring of fire with her, which was crazy. But, that means she was down there, which was great. I didn't have to like push her down and then push her out. And sorry, I lost my place. So that soothing movement was really great. And rose over your heart for courage. And I have the rose touch that does carousels, and it's just beautiful. It's really great. It stays with you a long time. It's kind of got the waxiness, rose petals feel waxy, so it just stays there, and I could just smell it. And it's just a glorious scent. So definitely want some sort of positive in the midst of transition, okay, as you're starting to push and everything. And pushing, just try not to clench your teeth, because you don't want to break your tooth or anything as you're pushing. And we just had the best nurses and an awesome doctor, and it was just like a chorus of voices encouraging me. One nurse was just saying, you just wrap around and just push through the pain. You can do it. Everybody was just encouraging, and it was just wonderful. So definitely have cheerleaders there. If you don't want a bunch of people, at least make sure there's that one person that's really, you can do this. You've got it. You can do it. She's coming, or he's coming. You want somebody there being an inspiration to you verbally, okay? And as soon as she was crowning, obviously get that peri massage oil to the doctor, because I think that really helped me not to tear as much too. I just had a couple stitches. But hey, that was really great improvement from my first daughter. And as soon as baby's out, they put them on you, right? So like skin to skin, most hospitals know that now. There's so much research out there that it's really important to do. So have baby come on and put a little bit of frankincense touch or less than 1% frankincense roller on baby's forehead and on your neck or chest or in your forehead, to help the trauma of the baby coming out of the womb and into the world, this bright environment, cold, and then for mom, for trauma. Because again, not to scare you if you haven't gone through it, but it can be traumatic, and that isn't necessarily a bad thing, but those are a lot of emotions, okay? That was a lot of pain you just experienced. You'd accomplish something amazing. So there's a lot of different emotions that are some high, some low, and I can't believe I just did this. And, and the placenta still has to come out, and then you're going to, and then the nurses come and they do massage on your belly, and it doesn't feel good. Okay. It hurts, to make sure that you're not going to hemorrhage. Okay. So there's a lot of things still happening, even though you have baby on you and they're out. The placenta coming out does not hurt at all, though, just so you know, as long as everything's going well. And had my friend also put Balance in the diffuser. I don't know if I said that. Balance is great. It's really grounding. It's got frankincense in it and blue tansy, and it's just glorious. So yeah, just enjoy that time. Don't rush anything. The nurses shouldn't be rushing you to feed. They shouldn't be rushing to clean off the baby or anything. And if they do, like this is something you can tell your husband, like, make sure I get a good amount of skin to skin, like a good 10 minutes, make sure the placenta's out, I'm stitched up, I have baby, because that helped really calm me while she was still stitching me up too, to be able to just be holding my child and them still be doing stuff that wasn't pleasant and didn't feel great, you know, but I could still be one kind of one mind with my daughter. So yeah, so advocate for yourself, okay? Have your husband advocate for you. It's a lot easier than you having to do it after that. And when you do start going to feed, definitely if you've had multiple babies, the uterine contractions tend to get worse the more babies you have, okay? So it's that wonderful benefit of the tummy slimming down kind of a thing, and but it can hurt, you know, the more babies you have, and some it's right away. While you breastfeed, uterine contractions are happening, okay? So it stimulates them. And so definitely want, to get some cramp bark or after ease. And I got after ease just off Amazon. My friend Angie Tolpin wrote this amazing book called Redeeming Childbirth, and she has a whole postpartum course with it now. So you can buy a bundle pack, and it's amazing. I'll put the link in the comments here. And that's where I've gotten a lot of my like kind of product ideas, and definitely After Ease was from her. So she's got a whole list of things, you know, if you end up hemorrhaging a lot, what you should do for that. She's got a lot of homeopathic, you know, remedies and things to do in a natural way and in a biblical way too. So it's a really amazing book. If you want to do stuff naturally, which I assume you do if you're watching this video, I highly recommend her postpartum course, because I'm not going to give you all the tips that she does. So definitely buy it. And then once I was all stitched up, everything's going well, either keep the balance going or switch back to like your typical favorite, whatever that might be. I brought along Holiday Peace with me because I just love it, and I still had some from our winter promotion, so that was great. And something I did bring with me to the hospital, because for the most part, like they give you the cleansing bottle, you know, but I brought my Peri spray with me. So you cleanse every time. They're going to instruct you on what to do. And so it's yellow because I have calendula oil in it here from home. And that's another thing that Angie had said to do. And that just helps to really like actually cleanse and not just water, and heal as well, which is great. But I took my Immortal. This is like a 3% dilution. And I would just spritz that on the pads they had there. And then same thing at home. When I'm home, I do my nice, you know, overnight pad, okay? You can do the thin ones unless you're like really bleeding, but even day one or day, when I get home from the hospital, day 3. So I do this, and then I do a couple of Tux pads, okay? I just buy the little pads because it's easier. And then over top, I spray this. And the Tux is nice because it's already cool, but then I also made to do some throughout the day whenever I wanted to, in kind of a smaller pad, just froze some water basically on it, and then I would put on the Tux pad and spray it, okay? And that's definitely, you know, from the hospital, use all their stuff. Then when you get home, you transition to stuff that you need to buy, right? Stuff that you have. So that was great. I really liked the padsicles, you know, so some people call them is what you freeze. And it was wonderful. It was great. It didn't leak, you know, and it was awesome. And this was something a friend said to buy. It's from like the nose Frida, you know. So this is the Friday. Get it? It's like a bidet. And if you have hemorrhoids or something, or a really bad tear, I could see this being really great more than this, because you kind of have to tuck a little bit to make sure you're cleaning well, to get everything right. And definitely if you have an elongated toilet seat, it's nice, but we have like the regular size. So like at night, I kind of just use this anyway, but definitely at night I was only using this one because I was scared I was going to dunk this in the toilet water, and I didn't want to do that. So I would say save your money and not get it unless, you know, you're just all about the products. Some people love them. It's got great reviews. I just stuck with this one. Okay, so that's pericare 101 that I like to do. And okay, definitely ask for extra big pads if you're still bleeding a lot. Usually they don't let you go home if you have the big clots or anything like that. But mesh panties, okay, sitz bath, okay, ask for those things. And then you buy the sitz bath herbs, okay, make sure they stay together. If you buy them loose, you need to make sure you have either some sort of a tea like container, or you like, because you need to actually make it as a tea and then pour it in. So cold or hot. I liked doing cold, okay. And then it just sits in your toilet seat, and then you just, can sit, and it's really nice. Okay, over the next few days, definitely in the hospital, but I'm talking more when you get home. At the hospital, you've got the nurses helping, all that kind of stuff, is pay attention to your sore muscles, okay? You pushed out a human being out of your body, and bravo, by the way, awesome job. But odds are you might have some slight tears somewhere, some micro tears, or at minimum you're feeling sore, okay? So mine was, I was doing, I was kind of curled up, and, like the nurse was saying, we wrap around it, which was a really great analogy, but I was really pulling on my husband, and my SCM and my neck was just really tight. So I was using some Deep Blue and some Aroma Touch, and was just doing some very gentle, but SCM is nice. It's one you can kind of, okay, it's this muscle right there. It's a supermodel muscle is what I call it. You can kind of pinch, and then you move along. You can always just do some gentle kind of effleurage, up and back and down, and you don't have the baby in you anymore, so you can do some pushing straight down on that bearing down point. It's not going to do anything except for maybe some uterine contractions, and then you just go for some after ease, okay? And I had some pain in my leg because it must have been the way I was holding it or pushing, so pay attention to those things. Apply copaiba or like I said, the Deep Blue or Aroma Touch, just in those areas, even if you don't want to massage it, but you can just get some of the oils going to work for you right away. And, the Deep Blue and Aroma Touch, though, do have peppermint in it. So I'm not that sensitive to peppermint, but if this is your first baby, or you're not sure if it's going to affect your breast milk, because it can for some people, then just do like copaiba, okay, or cypress, okay, something to increase some blood flow and just make you feel good and help the discomfort. Okay, and day 2 to 3, sometimes 4, but you're gonna have a big drop and surge, and just your hormones are gonna be going all over the place. But definitely about day 3, you're gonna have a big crying session, okay? Like, nothing's wrong. You're gonna be crying a lot, off and on, throughout definitely those first 2 weeks, okay? Those are the typical baby blue, the baby blues, okay? And you're just gonna have a lot of ups and downs, and maybe some tiffs with your husband, but just hopefully give yourselves a lot of grace, like I'm sorry goes a long way. I just had a baby, and that's usually all I have to say to Adrian. He's like, I get it, you're fine. And then like the postpartum period goes as much as 2 years after baby, okay? So if your big ups and downs don't even out a little bit after those 2 weeks, or definitely if you're having those feelings of harming yourself, harming baby, withdrawal, you just don't want anyone, you don't want to do anything, like past those first 2 weeks, be honest with yourself, talk to somebody, get help, okay? That's also very normal occurrences, okay? It can be very overwhelming for some people, and every woman is different, okay? A lot of women don't have strong bonding, love, ooey gooey feelings with their infant until the infant is a few months old at least as well. So be aware of that. Like, I love my kids and I would die for them as soon as they came out. But yeah, like, it takes a while, like, till they're actually smiling at you and, you know, that more interactive, they can hold their head up. You know, I love the newborn cuddles and they're just so precious, but they're just, you know, they're just sitting there. You know, it's kind of like puppies, right? Like, when they first come out, they just lay there and they're just little rats, right? Then they get cute in a few weeks. So give yourself grace if you don't have those strong feelings of love and attachment to your baby right away, because they'll come. Okay, they'll come. And more frankincense. I mean, just help yourself as much as you can using essential oils. Again, if you're using a mom baby, 1% or less, and give yourself grace. Okay. And in the diffuser, citrus. I just go straight for citrus. I don't bother with anything else. And at night, it's Serenity and Wild Orange. So there's still the citrus in there because of all the ups and downs. And if anything, I want to combat the negative emotions. Okay. Unless you're just really anxious and you're like, I can't do this. I'm not a good mom. I'm not going to be able to take care of baby. I mean, if you're getting frantic, yeah, put in some balance, put in serenity, talk to somebody. Drink a lot of water. Like, there's a lot of things you can do and get support, okay? So make sure that you're not going through those super high emotions, whether super high or super low, alone, okay? You don't have to be alone. There's a lot of support out there. Okay. Another good, if you're feeling traumatized and anxious, would be forgive, okay, or console. So think about those. You can also do those topically, okay? My favorites are Citrus Bliss, Cheer, Elevation during the day. Maybe adding Arbor Vitae or a fir if you want a little bit of that calming, but still want that mostly uplifting feelings. And your supplements, you guys, do not stop taking your LLVs, okay? Super important. Definitely be taking your probiotics, because that first poo when you get home is scary. And me, consistent with my probiotics, it was not a problem with Archer or Adelaide, and it's just been such a blessing because it was not that way with the first baby. Yeah, talk about traumatizing. So yeah, and then I'm also doing still On Guard Plus, because you're just in a hospital, you have an infant, there's other kids coming, people are bringing us meals, which is amazing, but then some of them, you know, not meaning to, but we're sick or whatever. And so you just want to protect yourself, and whatever you protect yourself with then is also protecting your sweet infant. And water, especially, and I hope you will try, and that's what we're transitioning into now, is breastfeeding. Okay. Really important for you to have a lot of water, not only to recover from, you know, like the night sweats, you know, or whatever you have going on with that. Really great is Whisper plus Balance and Wild Orange. If you're having extreme night sweats, okay, put them on the reflex points on your foot. But find a lactation consultant, okay? Preferably one who would come to your house, because then you're just relaxed. She can see you in your environment, what pillows you have, all that kind of stuff. And it's just amazing. And make sure that they will evaluate tongue and lip tie, because it's a real thing. My kids had them, and had is the right word because we corrected them. Okay, I'm not going to deal with that. It is torturous to try to go through breastfeeding with an infant who cannot have a great latch. Okay, we really want to make sure that they can get a good latch, that they're not fatiguing themselves and then going to sleep. And I mean, there's just so much going on those first few weeks with your emotions and physical stuff, that you want to make sure that you and your baby have the best chance at getting a good nursing routine going, and that you can breastfeed well. And she's waking up. And positioning, okay? Make sure you're bringing baby to you, okay? Because there's a lot of this, you know, with moms and trying to hunch over, and then you get that really bad back pain and there's just so much going on, and then you're like, I hurt and I'm trying to watch my baby and make sure she latches well, and so bring your baby to you. And I hopefully will be doing a whole video just on positioning for baby, but I'm not going through that tonight. And it shouldn't hurt, okay? So if it hurts, then you definitely need help, okay? There's a little bit maybe with letdown, but like if there's pinching or if they're biting or all sorts of stuff, like it should not hurt, okay? Get help if it is. A foam roller, okay, for that upper back stuff that I was talking about is really great to roll this way on the floor. Only go through your thoracic vertebrae, not your lumbar. Don't do your neck. This has just helped to kind of undo a lot of that and kind of nursing hunch, definitely if you're feeding upright in bed and there's not a whole lot of support for that. And try laying down, if you're breastfeeding, right? So side lying, there's lots of different positions you can try. You can try like a football hold. You can try, if you're laying down, baby's actually body's up here and then their head. Okay, so feet would be up here and then head, to try to just drain different ways. If you're prone to mastitis or clogged ducts, when you're done feeding, you can pump to relief, which is what I do. I usually pump twice a day. So I don't pump to empty, but I pump to relief because I make a lot of milk. Another thing you can do if you're feeling like you're getting clogged duct is to go in the shower and you massage that bad boy out, like until it's soft and milk has come out, okay? You cannot stay with clogged ducts or really hard ducts during the day or like an extended period of time, because it will start to develop possibly mastitis or something. So we don't want to deal with that. When you're breastfeeding, you need to have a snack station. Okay, if it's during the day, grab something before you go feed. If it's at night, make sure your water is by your bed or wherever. If you're going to get up and go to a rocking chair, have some graham crackers or something like that to support you. Because it's different for everybody, okay? And I get really thirsty personally, but I know a lot of people just want orange juice or a little bit of pick-me-up or graham crackers or something like that. Okay, and rest. I'm really bad at this, but can you hire a mother's helper? Can you nap on Saturday afternoons at least, if your husband works during the week? Can your mom come by, one day a week or something like that? You can get a little extra reprieve during the day, definitely if you have other kids, okay? Really important. Diet. Keep it normal as to what you were doing before. It can be hard if people are bringing you meals, which is amazing, but it's a little different. So, so be aware of that. Make sure you let them know about any dietary restrictions. And have some special things though around. Like if you like chocolate or gummy bears or something, like treat yourself. You just pushed out a human and your hormones are going everywhere. And yeah, eat some chocolate. Okay. But coffee. Okay. Were you doing it when you were pregnant? If you were, okay, keep it whatever you were doing. Don't necessarily increase. If you were not, be careful. Try it and then see what that does to you, what that does to baby. So just pay attention to anything in diet that's changing. Okay, because that's really important. If you add anything, you could take a food diary if you are having problems, or if baby all of a sudden is getting different rashes. Because a lot of babies are sensitive to dairy or wheat or gluten specifically, or a lot of that kind of thing. So just be aware that it might be your diet. Make sure you have high fiber, high protein snacks. Something that I liked, maybe not super high, but it's a banana plus Nutella. And Costco had this really great, better alternative to Nutella, so we got those. Really awesome. So some more self-care stuff. Call a chiropractor. I know what you're thinking, like, I've got babies, appointments and babies this and all sorts of stuff for baby. Like, I can maybe do some self-care at home, but no, like, call your chiropractor, get readjusted again. Like, I'm all about wanting to go as needed, maybe once a month, maybe it's once every 2 months, but right after baby, like, go once a week for a few weeks, and definitely once a week before, all throughout the 3rd trimester. Okay, so that your body can heal. Okay, well. And so I mentioned the back roller, back knobber. This thing is pretty cool. So it's called a back knobber. You can find them all over Amazon. There's lots of different types now, but this is great. So if you're like, oh, that foam roller just didn't do quite enough for me, so you can put it on that exact spot that hurts, and you just kind of pull, and it's really great. Okay, so, and that's something you can use all the time. Husband can use. My husband uses it more than I do. Ice. I mean, don't be scared of using ice on your neck or whatever. Heat. Definitely, if you are feeling engorged, there's a lot of inflammation in your breast the first few days. Your milk comes in about day 3. So, cabbage leaves or just icing or taking a cold shower is really great. Feels really good too. And again, I've said, be honest with yourself, be honest with your feelings, with your husband, and each baby might be different. So just be aware of that. And make time for you and your husband, okay? Obviously, don't have sex right away because you just had a baby. You don't want to get infection. But just make sure you're having good conversation, together for a little bit, especially if you have other kids. Make sure you're asking him how he's doing, because he has emotions too. Like, did you debrief about labor, or was it just like, okay, we did this thing, now we're home? Like, make sure you know where he's at, and if you can be an emotional support to him at all, depending on how you're doing. And sometimes just coming together and asking those questions can help you a lot. So don't do it alone, and doesn't just have to be for you. If you're that therapist type like I am, like, you can ask how he's doing, and then you guys can both share. And, oh yeah, I did like that. Oh wow, that was cool. Babe, I really loved how you encouraged me, as I was pushing. Like, I heard you, and that meant a lot to me, all those kinds of little things that husbands need to hear too. Okay. Phone stuff. So yeah, you get a lot of scrolling, definitely if you're breastfeeding and you've, got the baby latched, or you're trying to recover, so you're resting, so you're just scrolling through. So you might get some thumb pain. And definitely as baby gets bigger, a lot of times moms will pick up their baby kind of like, like this, and have pressure kind of down on the thumb, whereas you want to pick up baby like this, okay? So that you're not putting pressure directly on this joint, and stop the just constant scrolling by a pop socket, which is those little, like, kind of handles that go on the back of the phone. So that'll help with that. And then if you can, use the other finger if you're not holding baby or breastfeeding, or just go slower, just realize what you're doing. Again, you can do the deep blue on that joint. It's helpful to me because, yeah, I'm already experiencing some pain. So, and do something that makes you feel pretty or normal. Like, I kind of did my hair a little bit today. I took a shower. I don't take a shower every day, but I do try to get dressed in the morning, okay? Or just put on a little mascara, or, fix your bangs or something. Like, even if it is just getting dressed, changing from my pajamas to leggings, because I wear leggings a lot and I need to make sure to move. But something that gives your day a start can be really helpful for you emotionally and mentally, definitely. If you don't have any visitors the first 2 weeks. If you can prevent that. My mom was amazing with Olivia. She came for that first week and was just incredible. Like, she was cooking for us, cleaning for us. She did her own laundry. She did our laundry. She put it away. Like, unless you have somebody super helpful like that, that you also can be very honest with, don't let them visit for the first couple of weeks, okay? You need to be able to get breastfeeding down, to all the different appointments, take care of yourself, like all that kind of stuff. They'll understand. And if you and your husband are having some pushback about maybe his mother-in-law coming, or his mom, right? Like your mother-in-law, like, have a good conversation with him. Lay out some facts. Guys like logic, right? So it's not just you're being emotional, you don't like my mom, blah, blah, blah. Like, no, it's like, I love your mom. And we need to make sure that we are at some sort of normalcy, and that you're supporting me. This would really help me, and I think it would help our relationship. Like, set it up in a way that he can understand and he's logical, getting that logic behind it. And lastly here, baby stuff. So I mentioned the nose Frida. Definitely want the nose Frida. And your baby air. This is just normal air, which I realized I had bought this one. Oops, but it's the exact same as baby air, and I think it's cheaper. So this is just saline at a 0.65%, I think. And so you just squirt that up there, suck this out a few times a day. Obviously, they're suspended in liquid, until they come out into the world. And so it might sound like they're getting a cold or something. They're not. They're not getting sick. They are adjusting to really dry climate, okay? Even if you're in a very humid area, like, it's a lot drier than in the womb. So have that humidifier going for baby. Definitely be using this several times a day. Help loosen up that stuff so you can get it out so it's not trapped, all those boogies trapped in there. Something else I really like. There's debate on coconut oil, but I really like Earth Mama Angel Baby Natural Nipple Butter. Okay, and it doesn't bother my daughter at all. I put it on after I breastfeed so that most of it's absorbed when she goes back on. A 1% less of myrrh for the umbilical cord. Okay, you can start doing that like day 1 to just help make sure it dries out well, and it's got cleansing properties, so make sure it's not getting infected, and you just put it right on the umbilical cord until it comes out on its own, right? You don't pull it out. I really like using the Norix baby cloth to wash her, and she's had a bath, and she'll do just a Norix bath or a regular bath once the umbilical cord is out. And it's great because you don't need any soap. It's just water. Craniosacral therapist for baby. One that specializes in infants would be preferable. Okay, so that they can go in and see if there was anything off. Definitely a lot of times the cervical spine is off because they came out of, like maybe they're in the womb cockeyed, but they came out possibly dramatically, or Adelaide had her cord wrapped around her and stuff. So I don't know how she was maybe in the womb or if that happened as she was coming out. And she was definitely, C1, C2 were a little off. So the craniosacral therapist was able to do some releasing, and that was great. And I really like sleep sacks. There's lots out there. The Halo ones are the ones I like the most because you want to make sure that their hips can move freely. You don't want to restrict their hips at all. That can cause really, really bad damage, and a lot of times they'll need surgery or put them in those little hip things. Have you seen those? And we don't want to do that. Another great one is just the Muslin Swaddles, okay? The Aiden and Anais, or however you say that. They're about 47 by 47 inches, so squared, or you can make your own, right? And then you can do just the normal swaddle like that. Is really great. So yeah, that's my labor and delivery through postpartum in a nutshell, kind of, because it's been 45 minutes. I hope that was helpful. There are many resources. I will put some in the comments or the links below here for you, and just prepare, do what you can ahead of time. You know, take what oils you think you might want and some maybe even you're not sure about, just to be prepared, as well as keeping communication open. That it's so important. I can't stress that enough with your husband, because definitely if you're like getting annoyed at him or something, like you want to shut down, but don't shut down. Don't pull away. Let people in, okay? Because the people who are around you love you, okay? There is no reason to go through anything alone. Life's too short to just be able to want to do it alone, to want to put up that wall. I hope that you would be able to let people in and be content, you know, with your little one. And even if your labor and delivery don't happen the way you want them to be able to let that go and talk that out with whoever you can. Get the essential oils there to help support you, keep on your supplements, and find the joy back in life again. So here she is. Here's my little 2-week-old Adelaide, and we'll see you guys next time. Okay, bye.